Hi everybody, welcome back to my channel. My name is Ambi CS and this is officially the segment called PharmRescue. Something I thought about when I was writing my final attempt pre-reg exams. I've always been tutoring back at university, mentoring as well, so it was bound to happen, guys. It was. But this one, it's be focusing on things concerning pharmacy as the name implies. So it will be for pharmacy students, pre-reg pharmacists and newly qualified pharmacists, just to give you a guide, tutorials, and so many interesting things I have up my sleeves. But the first segment of it is going to be top 100 drugs. I promise you with less of my face in case you're tired of seeing my face on my channel, and there'll be more of learning under this segment called PharmRescue. Don't forget to check us out on Instagram, eventually Twitter, as well as Facebook, hopefully. First part of it would be focused on drugs that are mostly prescribed in the pharmacy but fall under the GI system. I hope I'm not talking too fast, but let's get right to it. So starting with aminosalicylates, what comes to mind? Me personally, if someone tells me aminosalicylates, I start thinking of the side effects. I think of the examples of drugs under aminosalicylates. So you have the sulfasalazines, mesalazines. I think about prodrugs. I think about dimers. I think about loads of things, but obviously for the purpose of this video, we'll be concentrating more on the side effects, the indications, the dose, the mechanism of action, that's how does it work, and whatnot, and other red flags. Sulfasalazine. Sulfasalazine is an aminosalicylate. Its indication is Crohn's disease, rheumatoid arthritis, and ulcerative colitis. For more information concerning this disease, don't forget to check out my tutorial on the GI. Side effects include taste altered, insomnia, urine discoloration, and tinnitus. So that's the ringing sound in your ears. So the dose for sulfasalazine depends on the indication being treated. So for treatment of acute attack of mild to moderate and severe ulcerative colitis and active Crohn's disease is 1 to 2 grams 4 times a day until remission occurs. Maintenance of remission, you reduce the dose a bit to 500 milligrams 4 times a day. Side effects for the inflammation blood disorders. I would mention a few symptoms or how you can spot blood disorders. Just look out for the stop and report slide in the next few minutes. But for blood disorders, you have to monitor full blood count. Also, just to explain that you can easily tell what exactly you monitor in a particular drug from the side effects, what exactly you would monitor in a particular drug from the interactions and the mechanism of action. So in a case of an exam, if you see scenarios that you can't really remember what you read in regard to the monitoring requirements, just try and think back to how does it work, the side effects and interactions, if that makes sense. So for blood disorders, usually it happens, or blood abnormalities are spotted within the first 3 to 6 months of commencing treatment. So that's why you obviously monitor full blood count. You monitor it initially, then monthly in the first 3 months interval. Renal function, the evidence for monitoring renal function isn't that clear. Some people advise to monitor renal function because it's metabolized by the kidneys. Liver function is also monitored monthly for the first 3 months interval. Patients and carers should be advised that sulfasalazine might color their contact lenses reddish orange. So the stop and report slide that I mentioned is basically explaining the symptoms you look out for when blood disorders or blood abnormalities start to occur in a patient taking aminosalicylates. So if a patient presents with sore throat, unexplained bruising, unexplained bleeding, unexplained fever or malaise, the patient or the patient's carer should be advised to stop and report. Hope that makes sense. So for your laxatives, what comes to mind when you think of laxatives? Just give it a thought. Well, for me, I think of difficulty going to toilet, hard stools, straining, lifestyle, diet. These are a few things that comes to mind. Duration of action as well. So if you see that sort of question, you know that's what you should think about. So let's start with Ispaghula husk, also known as fibrogel. How does it work? It's a bulk forming laxative. Basically, for constipation, you have the problem of small hard stools. So Ispaghula husk sort of bulks up the stool and makes it easier to pass through. Um, However, it's contraindicated in fecal impaction, intestinal obstruction, and reduced gut motility. It takes about 2 to 3 days for it to start working. So this is what you should have in mind when you're counseling your patients. A few side effects: bronchospasm, abdominal distension, GI disorders, and hypersensitivity. Ispaghula husk is sort of like a wit, so it is liable, or it is likely that you have that sort of reaction of hypersensitivity and allergic reaction. So the dose for Ispaghula husk, that's fibrogel, one sachet twice daily, usually in 150 ml of water. Patients and carers should be advised to take loads of water while taking this to help it work more efficiently. Avoid taking this before you go to bed, and usually, like we said, it takes about 2 days roughly to have its full effect. Lactulose is an osmotic laxative, so it works by drawing out water from the colon and increasing the volume of the stool. Indication includes constipation, hepatic encephalopathy. So onset of action for lactulose is about 48 hours. That's about 2 days. It's contraindicated in galactosemia and intestinal obstruction. What is galactosemia? Galactosemia is an increased level of galactose in the blood. As you remember or know that lactulose is a synthetic sugar, and most preparations contain monosaccharide galactose. And for patients suffering from galactosemia, or you do not want to increase the amount of galactose in their blood because it's going to make their condition worse. A few side effects: flatulence, abdominal pain, and diarrhea, and a bit of nausea and vomiting as well. The dose is usually twice daily. So for adults, initially 15 ml twice daily, then you take it as required. So for Senna, Senna is a stimulant laxative. So basically, it stimulates the muscles of the colon and enables the hard stool to be released quicker. Onset of action is about 8 to 12 hours, so it's faster than your lactulose and faster than your bulk forming laxative. Indication is constipation, contraindicated in intestinal obstruction, undiagnosed abdominal pain. A bit of side effects, or few side effects, include electrolyte imbalance, fluid imbalance, GI discomfort, urine discoloration. Side effects for the information: potassium. So prolonged and excessive use of laxatives, for example Senna, can lead to loss of potassium, that is hypokalemia. And if you remember, low levels of potassium can lead to prolonged QT intervals, which in the long run can lead to suicidal points and cardiac arrest, stroke, cardiac death. So this is why over the counter is very important to counsel your patient to avoid the excessive use of Senna or stimulant laxatives. And that's why you should hammer on the need for lifestyle changes first before agreeing to sell laxatives over the counter. So the dose for a child 6 to 12 is 7.5 milligrams to 30 milligrams. An adult is 7.5 milligrams to 15 milligrams daily. Maximum per dose is 30 milligrams daily. Usually Senna is taken at night time, don't forget, and most times you see 7.5 milligrams twice daily is the usual dose I usually come across in the pharmacy. It can cause your urine to be discolored, so usually a yellowish brown color is what you would expect. So, docusate sodium. It has a dual mechanism of action. It acts as both a fecal softener as well as a stimulant laxative. It's used in chronic constipation. It's advisable to avoid it if you have intestinal obstruction, and do not use with liquid paraffin. Side effects include abdominal cramp, and the dose is up to 500 milligrams daily in divided dose. As a fecal softener, obviously it softens the stool, and as a stimulant laxative, it stimulates it, it makes it easier to pass through the bowel for easy passage. So the next group of drugs that we'll be looking at is the antidiarrheal. So what comes to mind when you hear antidiarrheal drugs? I'll give you a minute to have a quick think before we go ahead. So yeah, personally, what comes to mind is loperamide, Imodium, ORS. Loperamide, how does it work? It works by reducing intestinal motility. It also acts by affecting water and electrolyte movement through the bowel. It binds to the opiate receptor in the gut wall, so it's a weak opioid. It's similar in action to codeine, but it's restricted to the gut wall. If you remember, codeine is also used in diarrhea, and it also reduces intestinal motility. And so it has similar side effects, which we'll look at shortly. So for patients taking loperamide, if they take more than the expected dose, they are likely to get the same euphoric effect as they would get if they were taking codeine or any other opioid, if that makes sense. Some of the indication includes acute diarrhea, chronic diarrhea, pain in bowel, colic in palliative care, fecal incontinence. Some contraindication includes antibiotic-associated colitis and active ulcerative colitis. So for antibiotic-associated colitis, what does this mean? It's caused, or rather, it's an inflammation of the large intestine. It happens when there's too much C. diff bacteria in the intestine. That's after taking antibiotics. Example of some antibiotics that cause this is clindamycin, cormoxiclav, amoxicillin, and a few cephalosporins. Hopefully we get the chance to look at that when looking at antibiotics. So, why is loperamide contraindicated in this case? In your large intestine, if you have a large amount of C. diff, obviously you don't want it to be restricted due to reduced intestinal motility caused by loperamide. You want to pass it out in your stool, you want it to be released from your bowel. So that would, if you take loperamide, that would prevent it from flowing freely out of your bowel, and that can cause to more complex issues. Caution includes, so it's not recommended for children under 12 years. Side effects, GI disorder, headache, and nausea. Exception legal category is to be sold to adults and children over 12 years for acute diarrhea. Exception legal category, diarrhea associated with IBS is sold for adults aged over 18 years. Unlicensed use, capsules not licensed for use in children under 8 years. So take note of this when you're selling it over the counter. Don't forget to ask the patient or whoever is buying it, who is it for and what is it going to be used for. So the symptomatic treatment of acute diarrhea for adults initially is 4 milligrams. So it usually comes in 2 milligrams capsules. So that's 2 tablets followed by 2 capsules followed by a capsule for up to 5 days. The dose to be taken after each loose stool. So if you take 2 capsules and you don't go to toilet, no need to take another capsule. But if you do still go to toilet after taking 2 capsules, you take another one. If you still go to the toilet after taking that capsule, you take another one, if that makes sense. And the maximum of 6 milligrams to 8 milligrams, so that's 3 to 4 tablets daily. Pain of bowel colic in palliative care, 2 to 4 milligrams 4 times a day, that's the dose for it. Important safety information, loperamide is one of those drugs that cause serious cardiovascular events. It increases or prolongs QT interval, so you should be notified of that and make sure your patient is aware not to overdose on loperamide. As you may know, loperamide is an opioid, so if you can remember or if you're aware of the treatment for opioid overdose is naloxone. Loperamide has a longer half-life compared to naloxone, which has a half-life of about 1 to 3 hours, so Usually, depending on how much has been taken by your patient, you may need multiple doses of naloxone to treat the overdose. The next group of drugs that we'll be looking at is proton pump inhibitors. What comes to mind? Yeah, omeprazole, lansoprazole, ulcers, Gord. So, in the group of PPIs, the drug of choice for this lesson would be omeprazole. It's one of those drugs that you see in the pharmacy a lot. It's prescribed as well as lansoprazole, but I'll be focusing on omeprazole as the case study. But this information applies to most of the PPIs. So how does it work? It's a proton pump inhibitor, so it inhibits the hydrogen ion pump in the body. It has a vast range of indications of what it's used to treat. Example, Gord, gastric and duodenal ulcers, Hpylori, NSAIDs associated ulcers. So for cautions, I've put together an acronym that would help you remember it in case you're asked in the exams. So FIGS, risk of fracture, GI infection including C. diff, G is for may mask the symptoms of gastric cancer, so gastric cancer. And S, patients at risk of osteoporosis. Usually it happens when a patient is prescribed this for a long-term treatment. So when you have to counsel your patients, bear this in mind, and if you see your patient prescribe this, look at their age, look at the presenting symptoms or past medical history as well. Some side effects include abdominal pain, constipation, nausea, vomiting, diarrhea, headache, insomnia, dry mouth, and skin reactions. So I've tried to group this slide in regards to tummy, mouth, so the nervous system, that's headache and insomnia, dry mouth and skin reaction, that's the mucosal membrane, if you see what I did there, so it's easier to remember. I've also put together an acronym just in case that's what you prefer. So an acronym that I put together, it might be a bit reaching, but don't blame me. But yeah, so hand disc. So headache, abdominal pain, nausea and vomiting, and dry mouth. Disc for diarrhea, insomnia, skin reactions, and constipation. This might be easier for you to remember in case you're in the exam and they said, okay, which of the following is a common side effect of PPI? So you can quickly just write down your hand disc. A very important safety information that you should remember is it can cause subacute cutaneous lupus erythematosus. Basically, what does that mean? It means it can develop in the form of lesions accompanied by arthralgia, so that's like pain in the joints, lesions, a bit of itch, worse than an itch, and some redness as well. It occurs weeks, months, or even years after exposure to the drug. So even if you had it about 4 weeks ago, a patient can come into the pharmacy and said, I realized that I've been having ache in my joints and a bit itchy, and there's this lesions that have developed on my body. Obviously, I wouldn't say lesions, but it'll be more of spots. They might say they have spots on your body that's very, very itchy. So once they say that, you can flag up that, oh, it might be because they've been on a PPI, so check their medical records and whatnot. But yeah, that's an important safety information that you should take note of. If patients develop lesions and it is accompanied by arthralgia, you have to draw the conclusion or the possible diagnosis of SCLE. So these are the steps you take. So sunlight, concealer, withdraw, treat, steroids. What does that mean? So for sunlight, advise the patient to avoid exposing their skin to sunlight. The next one is concealer. Consider discontinuing the PPI unless the benefits outweighs the risk. That is, if the patient is using it for acid-related condition. Withdraw the PPI, then treat. Usually you decide to treat if there has been no sign of remission in the last 2 weeks or a few months after stopping the PPI, because usually SCLE would resolve after the PPI is withdrawn. But if that's not the case, then you can treat the patient with steroids, either topical steroids or systemic steroids. So what's the dose for the PPI selected? That's omeprazole, 20 milligrams once a day, increase if needed to 40 milligrams once a day. NSAIDs associated ulcer, the dose is about 20 milligrams daily for about 4 weeks, continue to further 4 weeks if not fully healed. Monitoring requirement, PPIs reduce magnesium and would look at it going forward, and hypomagnesia is something that can increase the risk of digoxin toxicity. So be mindful of that if your patient is on digoxin and omeprazole and on the long-term omeprazole treatments. So prescribing information, lowest effective dose for the shortest duration of time. Why do they say this? If you can remember, the caution given is risk of fractures, risk of osteoporosis mostly happens because due to a long-term exposure to the PPI. The next group of drugs we'll be looking at is histamine antagonists. I've put cimetidine here, but this one is sort of awkward because the go-to would have been ranitidine, but because of what's going on presently with ranitidine being discontinued, you can't get it in the pharmacy. Prescribers have been told to stop prescribing it. You have a few doctors still prescribing it, but generally you can't get it in the pharmacy any longer due to MHRA warning of carcinogenic substance or so. If I find a link to the news, I'll put it down below. So, what is histamine antagonist used for? It blocks the H2 receptors. The H2 receptor is one of those receptors that have so many functions, literally so many functions, and different drugs tend to block it. But I think this one is specifically for the H2 receptors, the one that we're addressing at the moment. So it's used in gastric and duodenal ulcers and acid reflux. Caution: should not normally be used for zollinger-ellison syndrome because proton inhibitors are more effective. So your omeprazole, your lansoprazole. So this case study is specific to cimetidine, just to point further, and some other histamine antagonists. So it may also mask the symptoms of gastric cancer, just like omeprazole, like you saw. Side effects include constipation, diarrhea. It's funny because, well, not funny, but it causes both constipation and diarrhea. That's a side effect. Dizziness, fatigue, headache, skin reaction. Somewhat similar to your PPIs, just take note of it. I would also advise you, if you had to learn side effects in a particular section of the BNF, so GI, just take notes of the pattern so that you don't have to keep on going over it over and over again and trying to memorize it for each section. So what's the starting dose for cimetidine is 400 milligrams twice daily, taken with breakfast and at night. For B9 duodenal ulceration, you take it for at least 4 weeks. For B9 gastric ulceration for 6 weeks, NSAID associated ulcer for 8 weeks. Maintenance dose 400 milligrams daily, taken at night. Alternatively, 400 milligrams twice daily to be taken in the morning and night. So as you can see, the weeks differ depending on the indication you're using it for. GI anticholinergics. When I say this, what comes to mind? So I think of the effects of anticholinergics, so dry mouth, constipation, blood division, dilated pupils. But for this segment, we're focusing on GI anticholinergics. So example, Buscopan. So Hyoscine Butylbromide is the active ingredient in Buscopan, in case you do not know. Sometimes it's easy to confuse it for hyoscine hydrobromide, which is used to inhibit respiratory secretions as well as in motion sickness. It's also used to treat motion sickness. So just take note that hyoscine butylbromide is Buscopan. You can remember it by seeing the butyl, busco. It might be reaching, but you get my point. How does it work? It has anticholinergic effects on the GI tract. Indication includes irritable bowel syndrome, bowel colic in palliative care. It has quite a number of indications, but I've just listed 2. It's contraindicated with intramuscular or intravenous or subcutaneous use, because it can cause tachycardia. Like I said, tachycardia is one of those anticholinergic effects of anticholinergics. For all antimuscarinics, it's contraindicated in angular closure glaucoma, so it worsens it, it exacerbates it. GI obstruction, because it causes constipation. Then paralytic ileus and urinary retention, it's contraindicated because it also causes urinary retention, so you don't want to give a patient already suffering from that. The caution is acute MI because of the risk of tachycardia, cardiac insufficiency also due to the risk of tachycardia, congestive heart failure, prostatic hyperplasia, it causes urinary retention, and prostatic hyperplasia. It's a condition that's characterized by urinary retention, so it should be used in caution in patients with this sort of condition. For hyperthyroidism, if you can remember the sort of symptoms the person displays when they're suffering from hypothyroidism is increased heart rate. So due to the risk of tachycardia, it's best to use Hyoscine Butylbromide in caution in such patients. So the side effects is obviously going to be the anticholinergic effects of Hyoscine Butylbromide antimuscarinics. So that includes constipation, dilated pupils, urinary retention, increased heart rate, and uncommon side effects include skin reactions. Important safety information. It's advised that Hyoscine Butylbromide injection, usually used in palliative care, can cause serious adverse effects such as hypotension, anaphylaxis, and tachycardia. An acronym is HAT, which are fatal in patients with underlying heart disease, like we mentioned under the caution. Hyoscine butylbromide should be used with caution in the elderly. So these are the STOPP criteria. What is STOPP? Is screening tool of all the person's prescriptions. Basically a criteria that clinicians use to review the appropriateness of medications in older adults. Appropriateness stroke inappropriateness of medications in older adults. So this includes when the patient is prescribed 2 or more antimuscarinic drugs together, when the patient presents with delirium or dementia, narrow angular glaucoma, and prosthetism, prescription potentially inappropriate to treat extrapyramidal side effects of antipsychotic medications due to the risk of antimuscarinic toxicity. Also, going back with the potential inappropriateness of treating patients with delirium or dementia, it's due to the risk of exacerbation of cognitive impairment, because antimuscarinic carry that sort of effect. Narrow angle glaucoma, risk of acute exacerbation, or chronic prosthetism due to the risk of urinary retention. So that's why a prescription might be inappropriate to use in the elderly due to this STOPP criteria just listed. So I'll be looking at mebeverine, which is an antispasmodic. Indication includes irritable bowel syndrome. It's contraindicated in paralytic ileus. Side effects include angioedema, faceodema, which is swelling in the face, and skin reactions. Unlicensed use. So the granules is not licensed for under 12 years, while the modified release tablets are not licensed for those under 18 years. The dose in adults is 200 milligrams twice daily. For dose for children, please refer to the BNF. So antacids, what comes to mind? I think of flatulence. I think of I still think of ulcers, to be honest. Sometimes I think of Gord, acid reflux. I think of magnesium, aluminium, salts. I think of Gaviscon, of course. So, calcium, aluminium, magnesium containing antacids. How does it work? As an anti-acid. So obviously that's where the name is derived from, anti-acid. So it neutralizes the acidic effects in the bowels so that it's your tummy doesn't hurt in the simplest of terms, and so you can easily pass out gas if it's caused by gas, if that makes sense. So aluminium, magnesium, usually long-acting, as they are insoluble in water. Indication include dyspepsia of gastric acid and ulceration. Side effects for aluminium and magnesium containing antacids is constipation stroke laxative. So for aluminium it causes constipation, and for magnesium it acts like a laxative, so it causes you to go to the toilet very often. For antacids, something that we should take note of is patients presenting factor, or patients presenting medical history or past medical history. For patients with high blood pressure or heart failure and any cardiovascular disease, it is very important to take note of the sodium content. Antacids are very high in salt content, so you can see in the calcium, aluminium, magnesium, and sodium. So you look out for those preparations that contain low sodium. Examples are Malalox and Mucogel. So they have low sodium content. Also, when a patient comes into your pharmacy asking for Gaviscon over the counter, these are some of the questions you ask. Are you on blood pressure tablets? Do you have any presenting medical conditions that you need to be aware of? And so when selling Gaviscon or any antacids or antacids over the counter, always take note of this. Calcium containing antacids cause rebound acid secretion, hypercalcemia, that is high calcium in your blood, and alkalosis, which can lead to, in the long run, kidney stones. So that brings us to the end of GI drugs for this top 100 section on the PharmRescue. I hope you found this really helpful and you've been able to sort of recollect, and you found the diagrams and the symbols and the acronyms really helpful. If you have any questions, leave your comments down below. I hope to also put together some set of questions that would hopefully give you a guide as to what to expect, or what to look out for, and how you're likely to be asked questions in exams. Thank you so much for watching, guys. Don't forget to like, subscribe, share, and comment. Until next time, my name is Ambisi Ezem, and this is PharmRescue. Don't forget, guys, to like, subscribe, share, and comment. Until next time, my name is Ambisi Ezem, and this is PharmRescue.